Hi, my name is Janae Patterson, and I'll be talking a bit about the essay I wrote on substance abuse and mental health. The case scenario we were given to write our essay off of goes like this. A 54-year-old woman has arrived at the emergency room being escorted by the emergency medical services team. A jogger at the park was the one to call 911 when they saw the woman shout foul language and then fall on her face, incurring serious scratches on her face and her arm. Those who are tending to her observe her lack of hygiene from the smell of urine, dirty clothes, and overall odor. She is bleeding, confused, and aggressive. Her hands are shaky and trembling, and she thinks the EMS team stole her purse. She's also yelling at everyone that she needs some sort of a bottle. Substance abuse and mental health issues are commonly expressed in scenarios such as this. So based off of that scenario, I'm going to explain kind of what I was interpreting from that. And so based on what I can observe from this woman in the case study above, I would assess that she is going through some sort of substance withdrawal. The physical signs she is presenting closely match what happens to someone when they are going through benzodiazepine withdrawal, such as Ativan, and so this would be my first suspicion. There is also the possibility of other substance abuse, such as alcohol or effects of mental illness, as my second and third suspicions. It could even be the result of all three, benzodiazepines, alcohol, and mental illness, to make a dangerous combination that the woman is suffering from. Withdrawals from any substance have generally the same symptoms, but each substance has slightly varying or more violent manifestations than others. My main indicators for thinking it could be Ativan withdrawals are the key signs of hand tremors, irritability, and confusion. And these can be seen in other withdrawal situations, but hand tremors is a very significant indication of benzodiazepine withdrawals. Some health risks that I suspect she is also facing include addiction to benzodiazepines, alcohol, anxiety, panic attacks, and the effects of withdrawals, which again are very serious in the form of the health risks that are involved to liver, your heart, all the vital organs. So some reasons for the shaking, confusion, and combativeness that she was expressing could come from withdrawal, because withdrawal from alcohol creates tremors and can result in more serious effects of seizures and hallucinations. However, withdrawal from benzodiazepines are specifically known for hand tremors, which would explain why her hands are shaky. Her confusion and combativeness can be contributed to withdrawals from alcohol, benzodiazepines, or both, given that the brain has lost the stimulation from these substances and is trying desperately to get it back. So in order to conclude what exactly she's suffering from, some assessments would be needed, and I would first start with a blood test to see the concentration of the substance in the woman's blood level. That would be appropriate, including a liver function test to see how that's going, especially in terms to determine alcohol abuse. It would also be wise to have a hospital psychologist give a mental health assessment. The results of those blood tests, along with the mental health assessment, would reveal needed information in regards to how to proceed with treatment. And then mental health as a side subject. It's been brought up in more recent times as an aspect of healthcare that is just as vital and important to take care of as one would take care of his or her physical body. With advances in modern medicine, many people have access to both medications and supplements for mental illness, along with several methods of therapy. One very successful system of therapy is called cognitive behavioral therapy, one that I personally really like, and it's a way for people to learn how to see their experiences from a different perspective so that they have better feelings, which in turn creates healthier behaviors, because our thoughts influence our actions. Our feelings influence our thoughts influence our actions and behaviors, and that gives us our end result. And so I found personally that when I'm struggling with different thoughts on certain subjects, that if I can go back to identify what is creating those feelings for me, then I can work to make a thought in my mind that's more helpful, more positive, so that I can see a better result in my life. Meditation is another form of therapy that focuses on releasing negative thoughts and energy while absorbing more positive ones. I find that doing yoga along with meditation is also very helpful in relieving stress, which I can be very stressed sometimes, as can we all. But by combining the body with the mind through that form of exercise, physically and mentally, we're able to create a better future. So these kinds of practices develop mindfulness, which will help an individual be more aware of their thoughts, behaviors, and actions. From a pharmacological standpoint, selective serotonin reuptake inhibitors, SSRIs, other antidepressants, antipsychotic drugs, and mood stabilizers are all different types of pharmacological therapies to help alleviate and manage symptoms of mental disorders. Depending on what the illness is, there are multiple medications that can be implemented along with other methods of therapy. The best results are achieved when both psychotherapy and pharmacotherapy are combined. These methods of therapy have not always been easily accessible or affordable, but the Affordable Care Act, otherwise known as Obamacare, has tried to help ease this burden. According to healthcare.gov, mental and behavioral health services are essential health benefits. Because of this statement, the Affordable Care Act requires that most psychotherapeutic and pharmacotherapy options now have to be covered under all insurance plans. Though there are still exceptions and challenges with this, there is more recognition to the necessity of mental health services than ever before, and this will help make it even more accessible in the future. I personally feel that one of the best ways to help people cope with mental illness is to educate them. If we are implementing that in schools, we're able to help kids, teenagers, and adults alike to create a better future by learning those behaviors and techniques while they're young. And then at least with children being educated about mental health from a young age onward, they will be more equipped to get added help if needed and recognize those who are struggling as well.